the Maine CDC, more than 7,000 Mainers live with chronic hepatitis. Millions of Americans have this, and Maine now has one of the highest rates of new hepatitis B and C cases in the country. The past few months, there has been an increase in reported hepatitis A outbreaks at restaurants all across the state. That's according to the Maine CDC.
New today, the most recent possible exposure to hepatitis A was reported at a restaurant in Lewiston. News Center Maine's Ann Baldridge takes a look at how the disease spreads and what to do if you've been exposed.
The last few years used to be a lot rarer, but now we are seeing a lot more cases in the last 5 or so years in Maine.
The latest case of hepatitis A was reported at Marco's Italian restaurant in Lewiston, the third case reported in Maine since April. The owner of Marco's Italian restaurant, Dwayne Arnold, said, "The health and safety of our guests and staff are our top priorities, which is why as soon as we learned the situation, we began to work with the state CDC. The Maine CDC says cases of hepatitis A in Maine have remained elevated since the initial increase in 2019. This disease is primarily spread through contact with fecal matter.
It is a very highly contagious virus. It's found in very high amounts in people's stools who have hepatitis A, even if they don't have symptoms of it. And so it can be transmitted from people's hands who've been contaminated with that stool.
We reached out to Becky Jacobson, the executive director at Hospitality Maine, who says, "We hope it is not some sort of uptick, and most restaurants work hard for a clean environment for their staff and customers." Maine Health says this is a disease that could take up to 2 weeks after exposure to see any symptoms, which is why it tends to spread. If you are exposed, doctors say you should receive a hepatitis A vaccine. A single dose can give immunity for several years, but 2 doses are recommended. Ann Baldridge, News Center, Maine.